The need for Deltans to adhere strictly to the Covid-19 protocols was highlighted when the wife of the state governor and founder of 5 Initiative, Dame Edith Okowa, played host to the Covid-19 Zero Survey team in her office at Government House, Asaba. Eunice Emeazia reports.
Dame Edith Okowa said it is important to intensify advocacy on the need to adhere strictly to the COVID-19 protocols in the wake of the confirmation of a more deadly Delta variant of the COVID-19 in Nigeria. The governor's wife said many Nigerians have since relaxed their safety measures against COVID-19 due to the inconveniences the COVID-19 protocols sometimes cause, and advised Deltans to prioritize their health as the new variant is more contagious and dangerous. She commended the COVID-19 Zero Survey team for their efforts and urged them not to relent.
We need a lot of advocacy. Nigerians have relaxed. We relaxed before, but the level of relaxation is very high now. I don't know what we are going to use to preach to people to go back to their fixed mask. But I want to believe it's your job and my job. Let's keep talking so that we will remain alive at the end of all. We will see the end of COVID. Amen. COVID will not see our end in Jesus' name.
The leader of the delegation, Professor Rosemary Audu, said the survey was to estimate the burden of COVID-19 infection in the country, bearing in mind that transmission is still going on at the community level without adequate data to show. Professor Audu commended the support of the state governor, Senator Ifeanyi Okowa, to the COVID-19 Zero Survey team, which has enabled them carry out a lot of activities in the state, saying that it was a proof that the governor was interested in research for the benefit of Deltans. She said the team had visited the sickle cell centers established by the O5 initiative and lauded the efforts of Dame Edith Okowa, adding that they would want to carry out research on how COVID-19 and sickle cell are related.
So far, the achievements that we have been able to make is the fact that the capacity of the field workers within Delta State is being strengthened, from this 2 weeks engagement that we've had with them. And then also we are able to strengthen the capacity of the lab at the Asaba State Specialist Hospital. We have provided them with some centrifuges that I think it will strengthen the lab. And fortunately also, we have been screening for malaria. This is the season for malaria. We've been screening for malaria, and those who have tested positive, we have treated. So it's something that at the end of the day will even be able to, the data, the state will also use it in planning the malaria program.
The COVID-19 Zero Survey team, comprising officials of the Nigeria Center for Disease Control, NCDC, and the Nigeria Institute of Medical Research, were received by the governor's wife in company of representatives of the State Ministry of Health, Primary Healthcare Development Agency, Hospital Management Board, Drug Revolving Agency, Asaba Specialist Hospital ASH, Public Health Physicians, the Director General, and focal persons, all 5 initiative. Eunice Emeazia reporting.